Hello everyone. My name is Temitope Adeboyega. I'm a consultant pediatrician. Today, we'll be talking about cerebral palsy. By way of definition, cerebral palsy is an insult to an immature brain. We call it that there's a motor or adaptive presentation. Some other people will call it and say it is an abnormality of motor and posture due to an insult to an immature brain. The insult or the assault is permanent, but the clinical presentation is usually continuous. That is what cerebral palsy is. Cerebral palsy is seen all over the world, various causes in different countries. In our part of the world, in Nigeria, common causes ranges from severe perinatal asphyxia, neonatal jaundice, severe neonatal jaundice with bilirubin encephalopathy. Meningitis is also a known cause. There are causes that are prenatal, like infections with touches, that is the toxoplasmosis, rubella, cytomegalovirus, herpes, and Epstein-Barr viruses. Now, in some other countries, the issue may not be with severe perinatal asphyxia or severe neonatal jaundice, but there are other causes, perinatal infection, and no other inborn error of metabolism or degenerative disease will be responsible for cerebral palsy. By saying assault to an immature brain, it means that usually we're talking about children that are less than 2. Their brain are not that mature, so they're the ones that are commonly affected. Now, if we want to talk about type of cerebral palsy, we can talk about types in terms of motor dysfunction. We can say it might be it's mild, moderate, or severe. Some are actually crippling, that these children have to be on wheelchair. And it may be topographically, which part of the brain is being affected. It may be function of the motor system. Is it monoplegia? Is it hemiplegia? Is it quadriplegia? Or is it flaccid paralysis that we're talking about? Now, the etiology, just like we have said, some might actually be due to meningitis, a bacterial infection, occurring before the age of 2. Some might be due to touches infections around the perinatal area. Some, it may not be an infection, it may actually be because there's an inborn error of metabolism or some degenerative disease or some tubular disease, like the mild tubular diseases. And so many of the muscular dysfunctions might also be responsible. Now, if we want to talk about the clinical features ranges from mild ones, in which the child can actually, the developmental milestone have been normal, because one of the things that we see may be delayed developmental milestone, that the child is not able to control the neck when he's supposed to, is not able to sit with support or sit without support when he's supposed to, is not able to walk when he's supposed to walk. And we know that some other syndrome, like even T21, may affect baby in different ways. but we may not be able to say that they have we can finally define them as part of cerebral palsy, because it's a syndrome that's associated with mental retardation. Cerebral palsy usually does not occur in isolation. There may be some affectation of the adaptive function of the child, which is now known as, we used to call it mental retardation, but now is known as learning disabilities that have been divided into mild, moderate, and profound. So there may be some degree also in mild form of presentation of dysarthria, in which the speech is slurred. There may be some degree of deafness and child not be able to talk. It may also be associated with some learning disorders like the autistic spectrum disease or hyperactive diseases. Apart from that, the child might have hypertonia, the child might be drooling saliva, the child might not be able to walk. So there's a lot of need. In terms of management, what we do is investigation obviously is required, in which we need to do EEG, as the case may be. A CT brain scan or MRI may actually give us an idea, a clue into what happened. We might be able to see cerebral atrophy. We might be able to see even in some cases, some degree of hydrocephalus in some of these babies. In some touches infection, if you do an X-ray, we might be able to see different opacities, like in some disease like tuberous sclerosis, in some disease like toxoplasmosis. X-ray is also important. It is important for us to also do electrolyte anemia, magnesium level, and calcium. There are things that can be done, and a screening test in which we do the TORCH screening to know if there's an infection with this group of organism called the TORCHes. Now, by way of management, it's a multidisciplinary approach to management that we usually use. A lot of people have to be involved, with the pediatrician being at the center of it all. We need a psychotherapist. We need occupational therapists. We need a dietitian, because some of these babies might not be feeding well, because they may have problem with feeding. We need physiotherapy, because there may be some degree of hypertonicity that need to be relieved so that they might be able to make some adequate movement. The aim is to make sure that the child is able to do as much as possible to help him to do his daily function without assistance. But some are so severe that they may have to be on wheelchair. There's need for use of drugs. If the hypertonia is much, sometimes we give them diazepam to relax the muscle. Baclofen has also been used in relaxing the muscle of patients with cerebral palsy. But the therapy is usually a long-term therapy. It's not something that we just give drug for 1-2 weeks and say, don't worry, don't come again to the clinic, your child will be okay. We need to follow up, because some actually have seizure disorder associated, in which they need to be on one form of anticonvulsant or the other. Complication arises that some of them may actually have contracture and various kind of complications from the fact or disuse atrophy because they have not been functioning properly. Some might actually be blind depending on the aspect, the area of the brain that is being affected. Now, prognosis, the milder form are better managed. They are likely to do better. The severe profound form may have worse prognosis in terms of morbidity, in terms of the disease. Prognosis in terms of mortality, quite a number survive, but the morbidity is grievous. In a nutshell, I think I've been able to give us just a tip of the iceberg on cerebral palsy. If there are questions, queries, you can get back to me and we'll explain some of these things in details. But for now, I will leave you with this.